tongue tie, or ankylosing, is when the band that connects the tongue to the floor of the mouth is either too short or too thick, and it limits tongue mobility. You can have other oral ties, like lip ties or cheek ties, but those are much less common. In the old days, all tongue ties were treated. And in fact, 50 years ago, pediatricians had a little gizmo in their office where they just put it under the tongue, lifted the tongue up, and took scissors and just clipped it. Then that really fell out of favor because just too many kids were getting clipped, and it wasn't evident that that really accomplished anything. So the pendulum swung in a totally opposite direction, and basically nobody was getting their tongue tie clipped. Well, that wasn't good either because it did cause problems in some children. So now we're in a much better place where tongue ties are being treated, but only if it's clear that they're causing a problem. So first, how do you diagnose a tongue tie? Well, one of the first things you may notice is the baby can't extend their tongue all the way. They can't get it past their lower lip. And you may even see a little divot or a fork in the tongue because the tongue can't stretch all the way out because it's being held back by that tight band. The other thing you may notice is that a baby has trouble breastfeeding. They have difficulty with their latch, and you may actually even hear a click. It's very painful for the moms and very inefficient for the babies. So why should we treat this? Well, the reason why we should treat this is because uncorrected tongue ties can lead to long-term feeding problems, speech problems, and even chronic neck pain because babies will really strain their heads to try to get around what they feel in their tongue tie. So what do? You go to your pediatrician. Unlike what's been posted in lots of places online, pediatricians actually are well trained in this. So if you have concerns, have your pediatrician check your baby out. If they think there's a significant tongue tie and the tongue tie is affecting your baby, they're going to refer you to have that treated. And right now, most of the treatment is done by either ENT doctors, ear, nose, and throat doctors, or pediatric dentists. And they generally treat a tongue tie depending on how the tongue tie presents itself. They either treat by just clipping it or by laser. Usually babies really recover very quickly and you see the effects almost immediately. So if you do have concerns about a tongue tie, please see your pediatrician and certainly consider treating it.